For decades, we've all heard the same message repeated over and over again. Your blood pressure should be 120/80. Doctors say it. Health websites repeat it. Medication ads reinforce it. And most people believe it without question. But today, I need you to pause, because what I'm about to share may completely change how you think about blood pressure, especially if you're over 65. A brand new medical analysis published just weeks ago has raised serious concerns about aggressive blood pressure lowering in older adults. The findings suggest that chasing the so-called perfect number may actually increase the risk of falls, fainting, organ damage, and even early death in seniors. And that's not speculation. That's real-world data. I'm Dr. Christina Serrati, and after years of studying cardiovascular aging, I can tell you this with confidence: blood pressure targets are not one-size-fits-all. What protects a 45-year-old may quietly harm a 75-year-old. But before I tell you what numbers do make sense later in life, you need to understand why lower is not always safer as we age. Here's the uncomfortable truth. As we get older, our bodies change in ways that blood pressure guidelines often ignore. Your arteries stiffen. Your pressure sensors slow down. Your organs become more sensitive to drops in circulation. So when blood pressure is pushed too low, especially with medications, the brain may not get enough blood when you stand, walk, or even turn your head quickly. That's when dizziness begins. That's when balance weakens. And that's when falls happen. And in seniors, a fall is not a small event. It can be life-altering. Hip fractures. Loss of independence. Rapid physical decline. I want you to understand something very important right now. Many older adults who fall were doing exactly what they were told to do. They took their medications faithfully. They chased the ideal number. And they were praised for it, right up until something went wrong. This is why I'm asking you not to focus on numbers yet. Instead, I want you to reflect on how you feel. Do you ever feel lightheaded when standing up? Do you need a moment to steady yourself before walking? Do you feel unusually tired or mentally foggy since your blood pressure was lowered? If so, these are not just aging. These are warning signs. In the next part, I'll walk you through a real patient story that shows exactly how well-intended blood pressure treatment can spiral into tragedy when age is ignored. And more importantly, I'll explain what doctors miss when they treat numbers instead of people. But first, I need your confirmation. Let me tell you about a patient I'll never forget. Her name wasn't important to the headlines, but her story matters deeply. She was 78 years old, sharp-minded, independent, and living a full life. She cooked her own meals, went grocery shopping, attended church, and took pride in not needing help. Like many seniors, she had been diagnosed with high blood pressure years earlier. At the time, her readings were mildly elevated, not alarming, not extreme. Still, she was told the same thing many of you have been told. We need to get you to 120/80. So her treatment began. One medication became two. Dosages were increased. Numbers improved. Her doctor was pleased. On paper, everything looked perfect. But something subtle started to change. She began feeling slightly dizzy when standing up. Just for a second or two. Nothing dramatic. Nothing that seemed worth complaining about. After all, she thought, I'm almost 80. Feeling a little lightheaded must be normal. Except it wasn't. Over time, that brief dizziness turned into hesitation. She started standing more slowly, holding on to furniture, moving carefully, not because she was weak, but because her body no longer trusted itself. When she mentioned this to her doctor, she was reassured. Your blood pressure is excellent. Just stand up slowly. It's part of aging. That phrase, part of aging, is one of the most dangerous dismissals in senior medicine. Because what was actually happening had nothing to do with age itself. Her blood pressure had been lowered below what her aging body could safely tolerate. One early morning, she stood up from bed. The room spun violently. Her legs gave out. She fell hard. What followed was a cascade that no medication label ever warns about. A fractured hip. Emergency surgery. Weeks in rehabilitation. Loss of confidence. Loss of independence. And here's the part that breaks my heart. She never truly recovered. Before the fall, she was active. After it, she was afraid. Afraid to walk alone. Afraid to move too quickly. Afraid of falling again. Her world shrank from neighborhoods and social gatherings to a few rooms inside her home. Within months, complications followed. Reduced movement led to infections. Weakness progressed. Her body, once resilient, could no longer compensate. All of this began with blood pressure that was considered perfect. When paramedics later checked her blood pressure in different positions, the truth became clear. Lying down, it looked normal. But when she stood up, her pressure dropped dangerously low. Her brain simply wasn't getting enough blood. This condition has a name, orthostatic hypotension, and it is one of the most overlooked, yet deadly risks of aggressive blood pressure treatment in older adults. And the most tragic part? This outcome was preventable. If her treatment had been adjusted for her age, her physiology, and her symptoms, not just a number, she might still be alive today. In the next part, I'll explain why aging blood vessels and pressure sensors behave differently, and why seniors often need slightly higher blood pressure to stay safe. To understand why blood pressure targets must change with age, we need to talk about something most people, and many doctors, rarely explain clearly. Your blood pressure is not just a number. It's a delivery system. Its job is to push oxygen-rich blood to your brain, your heart, and your organs even when you stand up, walk, or change position. When you're younger, your body handles this effortlessly. But with age, the system changes. The first major change happens in your arteries. As we grow older, arteries gradually lose their flexibility. Instead of expanding and contracting smoothly with each heartbeat, they become stiffer. This is not a disease, it's a normal part of aging. But stiff arteries do not cushion blood flow the way younger vessels do. What does that mean? It means older adults often need slightly higher pressure to move blood upward to the brain, especially when standing. Lowering blood pressure too aggressively can reduce that flow just enough to cause dizziness, instability, and sudden weakness. The second change involves your body's pressure sensors, called baroreceptors. These sensors constantly monitor blood pressure and signal your heart and blood vessels to adjust when you move. In younger people, this response is fast and precise. Stand up, pressure dips, heart speeds up, vessels tighten, problem solved. But with age, these sensors become slower and less responsive. So when an older adult stands up, blood pressure drops, and stays low longer, before the body can compensate. If baseline pressure is already low because of medication, that temporary drop can become dangerous. This is why seniors often feel lightheaded after standing, not during exercise. Their systems simply can't adjust fast enough. The third factor is medication sensitivity. As we age, kidney and liver function naturally decline. These organs are responsible for clearing medications from the body. When they slow down, blood pressure drugs can stay active longer and hit harder than intended. A dose that works perfectly for a 50-year-old may be far too strong for a 75-year-old, even if the prescription hasn't changed. And finally, there's the issue of risk priorities. In younger adults, the long-term danger of high blood pressure, heart attacks, strokes, kidney disease, outweighs short-term risks. But in older adults, the equation changes. A fall today can be fatal within months. A fracture can end independence permanently. A sudden drop in blood pressure can be more dangerous than a moderately elevated reading. This doesn't mean high blood pressure should be ignored. It means it must be balanced, not blindly lowered. This is where many guidelines fall short. They were designed using data from middle-aged adults, not frail seniors, not people with slower reflexes, not bodies that respond differently to pressure changes. In the next part, I'll walk you through what modern research is now revealing about safe blood pressure ranges for seniors, and why slightly higher numbers are often linked to longer life and better brain function. Now that you understand why aging bodies respond differently to blood pressure, it's time to talk about what the science is finally catching up to. For years, blood pressure guidelines were built around one simple idea: lower is better. But those guidelines were largely based on studies of people in their 40s, 50s, and early 60s, not adults in their late 70s or 80s. That gap in research has had serious consequences. Recently, large-scale population studies focusing specifically on older adults have started to tell a very different story. When researchers looked at real-world seniors, not just the healthiest ones, they noticed something surprising. Older adults with moderately higher blood pressure often lived longer, stayed more independent, and experienced fewer dangerous falls than those whose pressure was pushed too low. In fact, seniors with aggressively lowered blood pressure showed higher rates of fainting, kidney stress, cognitive decline, and hospitalization. These weren't rare events, they were common patterns. Why? Because blood pressure in older adults isn't just about preventing heart attacks decades in the future. It's about maintaining blood flow today. When researchers analyzed outcomes in people over 75, they found that the lowest mortality rates were not in those with the lowest readings, but in those whose systolic pressure stayed in a moderate range. Not high enough to strain the heart, not low enough to starve the brain. This middle ground provided stability. And here's an important point most people don't realize: the danger zone for seniors is often on the low side, not the high side. Very low blood pressure in later life has been linked to increased falls and fractures, reduced kidney filtration, and brain underperfusion, a faster physical decline. This doesn't mean blood pressure should be ignored, it means precision matters. Another critical finding from recent studies is the importance of symptoms over numbers. Two people can have the same blood pressure reading, and completely different outcomes. One may feel strong and steady. The other may feel dizzy, weak, and confused. That's why modern geriatric care is shifting away from ideal numbers and toward functional safety. Can you stand without dizziness? Can you walk confidently? Can you think clearly? These questions matter just as much as the reading on a cuff. In the next part, I'll explain the actual target ranges that tend to work best at different ages, including what is considered safe after 65, 75, and even 85. These are not rigid rules. They are starting points that help protect both your heart and your independence. Now let's talk numbers, carefully and responsibly. Because when it comes to blood pressure in older adults, the goal is not perfection. The goal is balance. Based on current evidence and real-world outcomes, safe blood pressure ranges change as we age. What matters most is protecting the brain, preventing falls, and maintaining independence, while still reducing cardiovascular risk. For adults between 65 and 75 who are generally healthy and active, a systolic pressure between 130 and 140 is often ideal. Diastolic pressure should usually stay between 70 and 85. This range provides enough pressure to maintain good blood flow to the brain while still protecting the heart and kidneys. For adults between 75 and 85, the target often shifts slightly higher. A systolic range of 135 to 145 is commonly safer. Arteries are stiffer, reflexes are slower, and the risk of dizziness increases if pressure drops too low. Again, diastolic pressure should not fall below 65. Very low diastolic numbers reduce blood flow to the heart itself and can contribute to fatigue and chest discomfort. For adults over 85, or for anyone who is frail regardless of age, safety becomes the top priority. In this group, a systolic pressure of 140 to 150 is often acceptable, and sometimes preferable. Why? Because a fall at this stage of life can be far more dangerous than moderately elevated blood pressure. Maintaining steady circulation is more important than chasing textbook values. Now, for older adults with diabetes, previous stroke, heart disease, or kidney disease, targets need to be more individualized. In many cases, a systolic range of 130 to 140 may still be appropriate, but only if it is well tolerated and does not cause dizziness or weakness. This is why I emphasize something so strongly: your blood pressure target must match your body, not a chart. Two people of the same age can require completely different targets based on their health, medications, and daily function. Another critical factor is how blood pressure behaves when you stand up. A perfectly acceptable number while sitting or lying down can become dangerous if it drops sharply upon standing. This is where many falls begin, and where many treatment plans fail. In the next part, I'll show you how to check for this risk at home using a simple step-by-step method, and why this test is often more important than the resting blood pressure itself. If there is one thing I wish every adult over 65 knew how to check at home, it's this. Not your resting blood pressure. Not your doctor's office reading. But how your blood pressure behaves when you stand up. This single test can reveal risks that no standard checkup will catch. It's called the orthostatic blood pressure test, and it measures whether your body can maintain adequate circulation when gravity suddenly pulls blood toward your legs. Here's why this matters. Most dangerous blood pressure drops don't happen when you're sitting calmly in a chair. They happen when you get out of bed, stand up from the couch, or rise from a toilet, moments when falls occur. Many seniors have normal blood pressure readings at rest but experience sharp drops when standing. This condition often goes unnoticed until dizziness, fainting, or a fall occurs. Here's how to check it safely at home. First, lie down comfortably and rest for 5 minutes. Relax completely. Then measure your blood pressure and write it down. Next, stand up carefully. Within 1 minute of standing, measure your blood pressure again while remaining upright. If your top number drops by more than 20 points, or your bottom number drops by more than 10 points, this is considered orthostatic hypotension. For example, if your pressure is 135/80 while lying down and drops to 108/65 when standing, that drop is significant, even if both numbers seem reasonable. This drop means your brain may not be receiving enough blood when you stand. Symptoms can include dizziness, lightheadedness, blurred vision, weakness, trouble concentrating, and here's the key point: you don't have to feel dizzy for this to be dangerous. Some people adapt by moving slowly, but the risk of falls remains. Orthostatic hypotension is one of the strongest predictors of falls in older adults, stronger than age, muscle strength, or balance tests. If this condition is present, it often means one of two things: your blood pressure target is too low for your body, or your medication regimen needs adjustment. Many seniors are surprised to learn that improving this condition sometimes requires allowing blood pressure to rise slightly, not lowering it further. In the next part, I'll explain how doctors should individualize treatment when higher blood pressure is actually protective, and how to have a productive conversation with your physician about adjusting your target safely. One of the most important principles in senior health is something I repeat often: we treat people, not readings on a chart. Blood pressure management in later life should never be about forcing your body into a predefined box. It should be about finding the range where you function best, feel stable, and remain independent. This is where individualized care matters most. Two people can be the same age and have the same blood pressure, yet require completely different treatment approaches. What makes the difference isn't just the number, but how the body responds to that number. Let me explain. If your blood pressure is slightly higher but you feel steady, clear-minded, energetic, and free of dizziness, that may be a safer place for you than a lower reading that causes weakness or instability. On the other hand, if your blood pressure is high and accompanied by shortness of breath, chest pressure, or swelling, treatment becomes more important, but still must be done cautiously. Doctors who specialize in caring for older adults focus on 3 core questions. Can you stand without feeling faint? Can you walk without fear of falling? Can you live your daily life confidently? If lowering blood pressure compromises these abilities, the treatment may be doing more harm than good. This is why the phrase, normal for your age, should never be used to dismiss symptoms. Dizziness, confusion, and fatigue are not acceptable trade-offs for a number that looks good on paper. Another factor that often gets overlooked is medication layering. Many seniors are placed on multiple blood pressure drugs over the years, one added on top of another, without reassessing whether each one is still necessary. As bodies change, medications that were once appropriate may become excessive. This can quietly push blood pressure below safe levels. That's why regular reassessment is essential. A good blood pressure plan should evolve as you age, not remain frozen in time. In the next part, I'll give you a clear step-by-step plan for how to review your blood pressure safely with your doctor, what to bring to the appointment, and how to advocate for yourself without fear or confrontation. Now that you understand why blood pressure targets must change with age, the next step is knowing how to act on this information safely. This is not about stopping medications on your own or ignoring medical advice. It's about having a better, more informed conversation with your doctor. Here's how to do that properly. Step 1. Track your blood pressure at home. Office readings can be misleading. Anxiety, rushing, or discomfort can artificially raise or lower numbers. For 2 weeks, check your blood pressure twice a day, once in the morning and once in the evening. Sit quietly for 5 minutes before measuring. Write down every reading. This log gives a far more accurate picture of your true blood pressure than a single clinic measurement. Step 2. Perform the standing test at least once during this period. Perform the lying to standing test I explained earlier. Record blood pressure after lying down, a blood pressure after standing. This information is crucial. Many doctors never see this data unless patients bring it themselves. Step 3. Document how you feel. Numbers alone don't tell the full story. Make notes about dizziness, Fatigue, brain fog, unsteadiness of fear of falling. These symptoms matter just as much as readings. Step 4. Review your medications. Bring a complete list of everything you take, including dosages and timing. Ask one simple but powerful question: could any of these medications be lowering my blood pressure too much for my age? This invites discussion instead of confrontation. Step 5. Discuss goals, not just numbers. Tell your doctor what matters to you. Staying independent. Avoiding falls. Maintaining mental clarity. A good physician will help balance cardiovascular protection with quality of life. Step 6. Make changes slowly. If adjustments are needed, they should be gradual. One medication at a time. Small dose changes. Close monitoring. Sudden changes are risky. Slow, thoughtful adjustments are safe. Step 7. Reassess regularly. Your ideal blood pressure at 70 may not be the same at 80. Reevaluate every 6 to 12 months, especially if you've had a fall, you feel weaker. Your medications change. Blood pressure management is a living process, not a fixed rule. In the final part, I'll summarize everything you need to remember, explain why slightly higher blood pressure can actually protect your brain and independence, and leave you with a clear message you can carry forward. Let's bring everything together clearly and calmly. For most of your life, you were taught that lower blood pressure is always better. And for younger adults, that idea often holds true. But aging changes the rules, and ignoring those changes can be dangerous. After 65, your body needs stability more than perfection. Blood pressure that is too low can quietly starve the brain of blood, weaken balance, reduce kidney function, and dramatically increase fall risk. And in seniors, a single fall can begin a chain of events that leads to permanent loss of independence, or worse. This is why the idea that everyone must reach 120 over 80 is outdated. Modern evidence shows that many older adults live longer, think more clearly, and remain more independent when their blood pressure is kept in a moderate range, not aggressively lowered. For many seniors, slightly higher pressure protects brain circulation. Stable pressure prevents sudden drops when standing. Balanced treatment reduces dizziness and fatigue. The most important takeaway is this: your blood pressure target should support your life, not limit it. If lowering your pressure causes weakness, confusion, or fear of falling, that treatment needs to be re-evaluated. Feeling steady, clear-minded, and confident matters more than chasing a textbook number. I also want to be very clear about something. This is not about ignoring medical care. It's about modernizing it. Guidelines change slowly. Research moves faster. And informed patients are safer patients. You have the right to ask questions. You have the right to discuss alternatives. You have the right to prioritize your independence. If this video helped you understand your body better, I encourage you to share it with someone you care about, a parent, a partner, or a friend over 65. This information could prevent a fall, a hospitalization, or a serious decline. Thank you for spending this time with me. If you want more evidence-based guidance designed specifically for seniors, make sure to subscribe, and don't forget to turn on the notification bell so you never miss an update. I'm Dr. Christina Serrati, and I'll see you in the next video.